Hi, my name is Jessica Marsh. I'm a paramedic, and this is my abdominal trauma lecture. At the completion of this course, the paramedic student will be able to integrate pathophysiologic principles and the assessment findings to formulate a field impression and implement the treatment plan for the patient with a suspected abdominal trauma. Our first objective is, without the aid of references, the paramedic student will be able to predict abdominal injuries based on blunt and penetrating trauma with the appropriate mechanism of injury. Within the classroom setting, the paramedic student will describe the assessment findings associated with hollow organ injuries. This will be done successfully 3 times. At the completion of this course, the paramedic student will be able to differentiate between abdominal injuries based on the assessment and history. At the completion of this course, the paramedic student will be able to advocate the use of a thorough assessment to determine a differential diagnosis and treatment plan for the abdominal trauma patient. At the completion of this course, the paramedic student will be able to identify the need for rapid transport of the patient with abdominal injuries based on assessment findings. Abdominal trauma can either be a blunt force trauma or a penetrating trauma. Injuries to your abdomen are either opened or closed, and they involve a hollow or solid organ. You could have hollow organs or solid organs. Your hollow organs are your intestines and your gallbladder, your stomach, your urinary bladder, and your uterus. You have solid organs that are very vascular, like your liver, your kidneys, your spleen, and your pancreas. Depending on if you have a hollow organ or a solid organ injured, that's going to change the symptoms that you see with your patient. And if you are more of a visual learner, this is a picture of your solid organs and where they're located. And this is a picture of your hollow organs and their locations. Your hollow organ injuries typically take longer to show signs and symptoms. Your hollow organs, you need to remember, are not empty organs. They're organs that have a varying amount of liquid in them. So when the contents of the pancreas or the stomach leak into your peritoneal cavity, it's going to cause a lot of irritation and a lot of pain. We'll be talking about cavities that you can have hollow organs leak into, and I think that this slide helps show you some of that space. The retroperitoneal area is the area where your kidneys are hanging, and it's connected with this mesentery stuff. I always pictured it as like cobwebs holding up those organs, but mesentery is actually an organ that attaches to the posterior abdominal wall. So your organs like your uterus and your kidneys and your inferior vena cava, they are all attached to your body only by the posterior side with this mesentery. So just something to keep in mind if you have a patient suffering from a deceleration injury. Something else to remember with hollow organ injuries is that they can be caused by blunt trauma or penetrating trauma. Some people even hear a popping sound when the blunt trauma occurs. And keep in mind that it's the air and the blood in the peritoneal cavity that causes so much pain. An open abdominal injury, something to think about is the velocity of the object used to penetrate the patient's skin. Low velocity injuries are knives or other jagged objects. Medium velocity is more of the small caliber handguns, and the high velocity injuries, those are from the high powered rifles. It's alright if you can't determine what type of weapon caused the injury. You'll want to make sure, though, that you do know where the entry wound is and where the exit wound is. Closed injuries, it's pretty easy to see why that would be a harder thing to examine. It's hard to know exactly where the pain is. A lot of times you could have guarding, which is when your ab muscles stiffen up because you're in so much pain. The amount of fluid that may be in your open cavity in your abdomen, depending on how long it's been going on. There's a lot of variables with the closed abdominal injuries. Your solid organs, these are the ones that are highly vascular, and the hemorrhage will most likely be severe. So your liver and spleen and pancreas, kidneys, these are the solid organs that you worry about hemorrhage. First organ we're going to look at is your diaphragm. Let's say you have a patient who was in a high-speed motor vehicle accident. The patient presents with shortness of breath, abdominal pain, diminished breath sounds on the left, dyspnea when supine, bowel sounds are heard in the chest. When this injury is not noticed right away, the main symptoms point to bowel obstruction. What is the condition I am likely treating? Perforated diaphragm, also known as a traumatic diaphragmatic hernia. How you treat this patient is put them in the position of comfort, assist with oxygenation, monitor your pulse ox and capnography if needed. You'll want to get a 12 lead and an IV placed. Monitor and treat your symptoms. Every patient is going to look a little bit different. The best way to treat your patient is to obtain a thorough patient history. So when you turn him over for definitive care, the doctor could have as much information as possible. Abdomen. Your liver is, as you know, located in your upper right quadrant. Your liver produces bile and other proteins. There's other organs in our body that store and secrete bile, but your liver is the only organ that actually produces your bile. And it filters out your blood as it's coming back from the digestive tract, and it metabolizes your medications. You have a patient that presents with abdominal pain, ascites and jaundice are noted. Patient has pain in the upper right quadrant, and you see a bottle of milk thistle on the patient's table. What condition are you likely treating? Side note, milk thistle is an herb that is supposed to help a damaged liver repair itself. It sounds kind of crazy, but I bet maybe I've seen 8 patients who have this ascites and jaundice. It's a clear liver cirrhosis or liver disease problem. And even the alcoholics who are still drinking, you can also see a very large bottle of milk thistle somewhere. Usually I've seen it, so almost every time their milk thistle is sitting right next to their like giant bottle of gin. So not everybody who takes milk thistle is an alcoholic trying to keep their liver working, but it's just one of those things that you could put in the back of your mind, and if you see some milk thistle, you can remember I taught you that. Likely this is liver cirrhosis or liver disease. We're obviously not going to cure the patient. So how would you treat this patient? The treatment plan for this patient is a position of comfort, an empathy statement, good baseline vitals. If you feel like you need to palpate the abdomen, always start away from the side of pain. You can check the pulse ox. If you think capnography is indicated, then do that as well. Same with an EKG, do a 4-lead, 12-lead if indicated. Get an IV started and monitor the vitals en route. The next organ we're looking at is our gallbladder, which is also located in the right upper quadrant of your. Let's say you have a patient who presents with severe upper right quadrant pain. Sometimes referred pain to the right shoulder is noted, and remember that referred pain to the right shoulder is Kerr's sign. When you press firmly and upward in the right upper quadrant and ask the patient to take a deep breath, there will be a brief pause and inspiration due to pain. This is a positive sign of gallbladder involvement. Remember that the pain with inspiration is called a Murphy's sign. What condition am I likely treating? I know I did just give you the answer there with a Murphy's sign. This is when you would be dealing with cholecystitis, which is inflammation of your gallbladder. You could also have gallbladder stones, which is a picture that I found here. You can see the stones in there. You could also see the darkened part is the bile, and it fits right up underneath your liver, just like a puzzle piece. So what is the treatment plan for this patient? Treatment plan is going to be the same as all the other treatment, really. What these people need is a surgeon, not a paramedic or an EMT. So the position of comfort and empathy statement, getting a good history, getting a baseline vitals. If you see something that needs to be treated or addressed, go ahead and do that. Yeah, you'll want to try to get a large bore IV, 16 gauge at least in the AC. The hospital will like to have nice large IV access before the patient goes in for the scan. So it's just usually nice. I like to turn my patients over with an appropriate sized IV that will help them out so they don't have to start another one. Next organ we're looking at is our pancreas. Your pancreas is in your right upper quadrant. Your pancreas is an organ that has endocrine function and exocrine function. So it helps in digesting your food, and it regulates your blood sugar with your alpha and beta cells. If you have a patient that presents with upper abdominal pain with nausea and vomiting, patient is tachycardic and states she has unexplained recent weight loss. She is also an alcoholic who recently fell off the wagon. Patient has a positive Murphy's sign. So the condition that we are likely treating is pancreatitis. And that is a gross looking picture of a pancreas. When you are examining an abdomen, what will be helpful is to note that bruising around your belly button, that is Cullen's sign, and bruising on your flanks is this Gray Turner sign. Both of these signs are late findings, and they indicate bleeding in your abdomen. This is never a good sign to come across as a first responder. It means that this patient has needed medical attention for quite some time now. The treatment plan for these patients is the position of comfort, get a good baseline vital, and get a good history. So when you turn them over to the nurse at the hospital, they could have all the information they need. And a reminder not to forget the basics with your sample and your OPQRST. Next organ is our spleen. Our spleen is located in the upper left quadrant
of our abdomen. The next organ we're going to talk about is our spleen. Our spleen is located in the left upper quadrant. This diagram on the right helps, well, it helped me anyway, to picture where the spleen is located in my body, right behind that left kidney and kind of right behind and to the side of the stomach. So when we talk about a spleen laceration, you could see the cavity space it could fill. And that is a picture of your spleen. If you have a patient who's been involved in a high-speed motor vehicle accident resulting in death for the driver of the car she was in, your patient is ANO times 2, complains of dizziness, hypotension is noted with severe upper right quadrant pain, and a positive Kerr's sign. Remember, that's when you have severe pain in your shoulder due to blood and other irritants in your peritoneal cavity. So what condition are you likely treating? The spleen laceration.
The treatment for a ruptured spleen, you want to have them in the position of comfort. Get a full set of vitals. When you go through getting a full set of vitals with lung sounds and capnography and IV placement, depending on the scene that you pull up on, most likely these are all going to be evaluated in the back of the ambulance on the way to the hospital. You're not going to be hanging around on scene going through your secondary assessment.
Next, you have your kidneys. Your kidneys are on your right and left side, kind of right in the center of your abdomen. Let's say you have a patient who presents with severe, sharp pain in his back and in his flanks. He's noticed blood in his urine, and he's sweating and is nauseated. What condition are we likely treating? We are likely treating kidney stones. So the treatment for kidney stones is going to be position of comfort, get a good baseline vitals, have an IV placed, and consider an antiemetic or a pain medication for these people. Next organs we're going to talk about are your intestines, your large and small intestines. Let's say you found patient supine and his intestines are coming out of his abdomen. What condition are you treating?
This would be a patient with evisceration, where you have abdominal organs coming outside of the skin. What is the treatment for this patient? The treatment for evisceration, one, we want to make sure that we stay calm. People on scene are already going to be very upset at seeing all of this, so we need to keep our own cool. People look to us to come and take care of this patient. So you want to make sure you don't ever want to try to push any organs back into the abdominal cavity. You're going to cut the clothes off, make sure you're not pulling. If there's any clothes stuck to the body, just leave them there. You don't want to be ripping those off. And then a moist sterile dressing secured with the four-sided occlusive dressing on the abdomen, the best that you can. And then again, just keep your cool and bring your patient to the appropriate hospital. And afterwards, you can discuss with your partner about the crazy call you just ran. There are different types of pain that we encounter. One of the types of pain that we have is somatic pain, and that's where you could take your finger and point to directly where your pain is. Your pain does not radiate. Your pain is directly where you are touching. Visceral pain is a little bit different. It comes from your internal organs. Our internal organs, especially the vascular organs, are very sensitive to being stretched or having any kind of inflammation. So when you have pain that comes from one of these organs, instead of the pain being directly to where you can point to that pain, the pain is diffuse. It's all over. It's vague sometimes. You'll see this in patients who are suffering with appendicitis or gallstones or even chronic chest pain, diverticulitis, or pelvic pain.
Referred pain is when you have a site of your body that's injured and you feel the pain on the opposite side of your body, like when you have a heart attack and the patient feels the pain in his jaw or arms. In the gallbladder, you'll often have pain in the back of your shoulder. Rebound pain is a strong suggestion of peritonitis. A patient who has a positive roving sign, that's when you have pain in the lower right side of your abdomen when pressure is applied and then released on the lower left side of your abdomen. And that roving sign is a positive sign for appendicitis.
Always remember, don't forget your basics. You can only treat what you identify, and you can only identify something if you can get a good, thorough history and a good, thorough assessment. So just remember, it takes a lot of practice to effectively rattle off this sample and OPQRST when you're actually speaking to a patient who's in a ton of pain. The more you do it, the better you can make it feel like a natural conversation between you and the patient. It doesn't feel like they're just answering a barrage of questions. It's important to remember that these patients will likely need a surgeon. It's our job to get them to the hospital safely. We need to be able to identify the priority 1 abdominal trauma patients so we can get them to the hospital quickly and make sure we deliver them to a hospital that can appropriately handle them. Thank you for listening to this presentation. I hope you learned something helpful today. Thanks.